Hello, I'm Dr. Raylene Wang. I'm a family medicine physician at Southeast Lincoln Family Medicine Clinic. I've been practicing for 16 years in Nebraska. I like the family medicine because for the full spectrum for the practice, it's covered all age group of a family, from newborn to grandparents, from general physical exam to the complicated chronic and medical illness. We also do minor procedures in the office too. I enjoy taking care of the whole entire family, and I like to see all members in the family stay healthy and everyone has a productive life. And from the newborn babies, you watch them grow. It's such a wonderful thing. And also take care of geriatric patients too from nursing home, and I like to talk to them as well in the office. It's all variety of care and help people get better, especially after patient follow-up, after they improve the medical condition, so that's really nice. This is a great, perfect group combination. We all work together and cover each other's calls, cover each other's patients, and all the staff in the office is very helpful. I'm happy to be here. I do speak Chinese. We have quite a bit of people coming in with their parents not speaking Chinese, which I help them a lot, and the relatives of Chinese friends. Patient can expect my courtesy, respect, and professionalism. I think that what's important for me is the patient trust. I always want to do my best to earn the trust.
Hi, I'm Dr. Eric So, and I'm a podiatrist at Capital Foot and Ankle. I first became interested in medicine when I was a teenager. I was very involved with sports and had my fair share of injuries, and my fair share of doctor's appointments. And so I was always interested in biomechanics and kinematics of the human body, which drew me to this specialty. I'm a fellowship-trained foot and ankle surgeon. I'm board certified in foot and ankle surgery. I completed my medical degree at Des Moines University in Des Moines, Iowa, and then completed my foot and ankle surgery residency at Ohio Health Grant Medical Center, which is a level 1 trauma center in Columbus, Ohio. I then subspecialized in sports medicine and reconstruction at the Core Institute in Phoenix, Arizona. I'm quite involved with medical research. I conduct several multi-center research trials and other research projects to really focus on how to improve patient care. I also teach across the country by lecturing at various medical conferences, as well as teach others on the newest surgical techniques. The demographics of patients that I see vary widely from very young to adolescents, to middle-aged people, to the very elderly. Because of that, I see a wide variety of conditions such as heel pain, bunions, chronic arthritis, ingrown toenails, sports injuries like ankle sprains or Achilles injuries. I always try to offer non-procedural or non-invasive options first, but as a foot and ankle specialist, sometimes we can offer pain relief by performing procedures. I specialize in minimally invasive surgery and arthroscopic surgery, and as well as ligament repairs and chronic instability of the ankle. I also specialize in total joint replacement surgery of the ankle. Other conditions that I commonly treat surgically would be deformities such as flat feet or high arches. One of my mentors taught me that we have one mouth and two ears, and so we should listen more than we speak and need to listen to the patient to understand when does it hurt and understand why does it hurt when it does. Oftentimes we find a wide array of treatment methods that can tailor to your lifestyle as well as your occupation, as well as to your specific diagnosis. Being a part of Bryan Physician Network definitely has helped me obtain all the tools that I need to provide the most comprehensive care to patients, both in the clinic and then also in surgery. I truly enjoy the patient interactions on a day-to-day basis and getting people better.
My name is Azusa, and I'm a family nurse practitioner and working for Bryan Neurology. I was born and raised in graduate college in Japan, so I speak Japanese. And then I actually have a quite an interest in a different culture. Initially, the reason why I got into nursing is that I get to see so many different kinds of people at the real personal level. When I first got a job as an RN, I saw neurology routinely on the floor, and the neurologists come in and assess my patient and do all this series of examination. You have a whole brain, but he pinpoints exactly where the problem is. And then at the end, sure enough, the problem is the right small area of the brain where he said it will be. It's kind of amazing. I thought it's kind of like a magic. My main philosophy is that I believe in a connection between the mind and then the disease process. So as a healthcare provider, we tend to focus on what's wrong, but I always want to make sure that I look at the patient as a whole and try to provide a holistic care. I am a neurology nurse practitioner, and we take care of a lot of stroke patients, kind of basically like a heart attack happening in the brain. So older age is very common, and we see encephalopathy, which is like basically brain malfunctioning when the patient has other baseline issue to their bodies. Stroke patient actually needs to be taken care of by an interdisciplinary team. We cannot lack even one team out of this to take care of the patient. It's very important that we have a whole team together at one location. That is amazing. I mean, that's what the Bryan can provide for a patient, and I can tell you that it's rewarding to see such a recovery in the patient. I am very happy to be working as a nurse practitioner.